Everyone, and happy Sunday to all. We'll be keeping it brief for you this afternoon. I'm pleased today to welcome home from overseas the 1st Battalion of the 178th Infantry Regiment of the Illinois National Guard. Under the command of Lieutenant Colonel Matthew Garrison, 400 of our most exemplary Illinoisans served in Afghanistan to advance Operation Freedom's Sentinel. These are remarkable individuals who possess a phenomenal strength. And as soldiers of the 178th Infantry, also carry the legacy of having descended from the nation's first all-black National Guard unit, the Fighting 8th. As governor, I have the honor of serving as the commander-in-chief of Illinois' citizen soldiers. And in my first 16 months, I've learned a thing or two about the 13,000 women and men who make up the Illinois National Guard. Namely, they're an astonishingly humble group, even though they've earned the right to take extraordinary pride in what they do. In the midst of this COVID-19 emergency, I hope you've had a chance to see, as I have, just how amazing the Illinois National Guard is, because it's the Guard that's setting up our drive-through testing sites to serve our first responders, our medical professionals, and everyday residents. It's the Guard that has helped to build the alternate care facility at McCormick Place at a jaw-dropping record pace. It's the Guard that has provided critical surge support as we've managed outbreaks in our facilities. It's the Guard who deserves our deepest reverence and gratitude. I also want to share more positive news on the PPE front. We have another airlift of PPE arriving tomorrow in Illinois. That follows our first flight that landed earlier this week. I'll note that it's the Illinois National Guard handling transportation logistics on the ground and ensuring that our protective equipment gets to the front lines in the COVID-19 battle. These millions of masks and gloves and other PPE will be taken to our state warehouse where inventory and performance quality checks are done before we ship them out to keep our first responders and our healthcare professionals protected as they work to keep us safe. If it strikes you as atypical that in the midst of a national emergency, a state is directly airlifting emergency response materials from another country, well, you'd be right. But that's the landscape that we're operating in, competing with other states, other countries, and even our own federal government for supplies. So if an airlift is what it takes to bring the PPE to protect our nurses, our firefighters, our police officers, and other essential workers, then it's an airlift that we'll use without hesitation. Thank you all for tuning in over the weekend. We'll be back tomorrow with our regular update. Before we move to press questions, I'd like to turn it over to our Director of our Department of Public Health, Dr. Ngozi Ezike, for today's medical update. Doctor.
Thank you, sir. Good afternoon. And thank you for everyone who tunes in every day as we report out the latest developments and the governor shares his plans to help us through this difficult time. Your ability to stay informed and to use that information to make good personal choices is what drives our efforts each day. Our goal is to give you the most up-to-date information that will help you understand, of course, that COVID-19 is very serious, but especially to make you understand the essential role that each of you play in helping Illinois get back on track. Today, I announced that there are 1,197 new cases of COVID-19 and unfortunately 33 new deaths. That brings our state total to 30,357 and unfortunately 1,290 total deaths. I know the COVID-19 pandemic can be overwhelming for parents and is concerning as well to children. As a mother and as a pediatrician, we recommend that parents, guardians, and others who work with young people strive to help them feel understood empowered, and yes, hopeful. Assure children that doctors and other healthcare workers are learning as much as they can about this virus as quickly as possible and are doing everything that they can to keep them safe. Empower them to keep themselves safe by following guidelines on physical or social distancing, cleaning surfaces, washing their hands, and wearing masks. Encourage them to feel comfortable in sharing their emotions during this tough time. We all need extra support in this unprecedented moment in history. I receive support from my public health team, my local community, my faith community, and my family each day. We all have to support each other in these trying times. COVID-19 has dramatically altered all of our lives. It's changed our way of learning, working, recreating, praying, sharing, everything. It's also stolen precious loved ones from us and even changed how we mourn for them. Though we can never go back to how we were and will never get our loved ones back, we still must stand together and employ the ongoing required sacrifices to end this pandemic. Let's continue to be all in Illinois.